most frequently asked question is, am I ready for surgery? And I explain to my patients there's a graph in life where pain is gradually going up and function's gradually going down. And where those two intersect, most people are cognizant that something must be done. And that's an intuitive thing that the patient knows instantly. Some go too long, some are premature about it. And there are many times I'm ushering people away saying, you're not ready, take an anti-inflammatory and I'll see you in 2 or 3 years and we'll reevaluate.
And when we get into these discussions, it's about, well, how is a partial knee different? And it preserves your normal anatomy, so it's a normal feeling knee. And that's why when I talk to people, I have patients that have a total on one side and a partial on the other, and I say, what's the comparison? They say, no comparison. And I'm like, well, what do you mean? They're like, well, my partial feels like a normal knee. My total's better than it was, but it's not like a normal knee.
The most common questions that I have are, how do I know I'm ready for a joint replacement? They come in and they say, hey, my hip's been killing me for 4 or 5 months now and I'm not able to do the things that I want to do. The other most common things I get is, what's surgery like? What can I do afterwards? What's the process? How long does it take? Do I have to stay in the hospital? When can I get back, to the things that I love to do? And we take time, we go through those things, and people are usually fairly satisfied.
A lot of patients are afraid to have surgery and feel like their doctor is jumping to surgery as the only option. And so a lot of patients in my practice will say, are there other options? What else can I do prior to surgery? And I'm very conservative and I like to have patients try the easiest treatments and work their way up and have surgery be the last choice.
Am I going to be able to do the things that I enjoy doing? Am I going to be able to swim? Am I going to be able to hike? If I skied before, can I ski afterwards? So people want to know where they're going to eventually get with their operation. What is the outcome going to be? And they want to know how long it's going to take them to get there.
They really want to know, how can I continue with their arthritis, with some deformity? What is our ability to keep them going? And so there's an education process we take on with that. There we move that into then, rehabilitative programs, bracing options. And so most patients really don't want to get old. Most patients want to stay active. And that's nothing more exciting than a 76-year-old who wants to continue running, and you can help them meet their goals and objectives. So that's exciting.